morning. I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. On behalf of our Board of Directors, staff, and volunteers, we want to thank you for joining us today. As always, we want to start by recognizing our Board of Directors who are in the audience. So if you're here, please stand. Board of Directors from our Chamber Foundation and the Chamber proper. We also want to thank United Healthcare for sponsoring this now our 5th Health Summit here at the Hispanic Chamber of Commerce. In the audience, we have entrepreneurs, we have physicians, nonprofits, hospitals, insurance agencies, et cetera, et cetera. So we hope before you leave here today that you make some great introductions, some great contacts so that you can take the information we're providing you and make sure most of all that you do business with one another. So on that note, let me touch upon a couple of data points. The Houston area Hispanic leads the charge in health insurance growth. And so that's why you see here today that Dave Milich, who represents United Healthcare and is the CEO for United Health, is here to talk to you more about what that means for Latinos in particular. More than 150,000 new Latinos in the region enroll in health insurance in 2015. Also, the Houston area Hispanics represent over 1/3 of the adults receiving medical services in the region. That's more than 1.2 million Hispanic adults. Latinos spend over $3.3 billion in this space. That's billion with a B. Please enjoy the presentation that's going to be on just now. Thank you.
Health equity, to me, means ensuring that there is equitable access, equitable care, and equitable outcomes for all individuals seeking care. Populations that we focus on are purely driven and determined by what the data shows us. The analysis clearly tells us where the opportunities for improvement are, and then we move to action from there. You personalize based on not just the population, but the geography. There are cultural differences between African Americans in Mississippi and New Jersey that you need to be sensitive to. So it's personal to them, it feels personal to them. So examples of those kinds of activities will be what's going on in New Mexico with the Resource Center and how it's very personal to the Navajo Nation.
Our United Healthcare Resource Center here in Shiprock really represents the collaboration between two different worlds. It's the huge population of the Navajo Nation, with the largest piece of it being here in Shiprock, and this large corporation, United Healthcare, coming together to serve the local individuals. It is a cyber cafe. It's a resource site where folks can come in and apply for social services. They can get assistance with their healthcare needs as far as what their healthcare coverage might be, identify transportation, you name it.
As an organization, we're committed to making sure that we put those right people in the right places to deliver the right care at the right time in the right way, so that over time we see care improve. You know, I started the Health Equity Services program in June of 2010, and to think how many champions there are around health equity at every level of the organization and how much of a commitment and priority it has become. We each have a stake in ensuring that we're delivering on the mission to help all people live healthier lives.
Part of our initiative includes making sure we're interfacing with our elected officials. At the Houston Hispanic Chamber of Commerce is at the table as it relates to public policy. So now what we'd like to do is go ahead and show you a brief video brought to you by Congressman Gene Green.
Hello, my name is Gene Green and I'm a member of Congress from North and East Houston, Harris County. I want to thank the Houston Hispanic Chamber of Commerce for its advocacy for Latinos, for business owners, for entrepreneurs, helping the community continue to grow and be successful. As a member of Congress, I work on the Health Subcommittee. I'm a senior Democrat on the Energy and Commerce Health Subcommittee, and I work on health care. I want to thank the Chamber for their work in the community, because we always want more people to get jobs and have insurance, health insurance. But also my concern is that the medical research, which we do in the Houston area, our community has a lot of issues that are chronic issues, healthcare, and I want to make sure our medical research can get those new cures that we do for some of the things we think of every day or have. Nowadays we talk about Zika or infectious diseases or Ebola 2 years ago, but I also want to not only take on those, but also the ones that are chronically in our district that people have, so we can find cures for those successful. And I want to again thank the Hispanic Chamber for having a health summit, because that's so important in our community, not only in Houston, but all across the country.
So joining us today, we have George Gardner. He's the Regional Vice President for NorthHighland. They are a consulting firm, and they do work in the healthcare space and energy space. Please welcome again George Gardner. He's the Regional Vice President for NorthHighland.
What we'll start with is what we see as the three main drivers as far as opportunity. Primarily, it's the growth of the Hispanic American market. So this is always a statistic that really amazes me when I see it, and also amazes a lot of the audiences when I talk to them. Hispanic Americans are growing at 3 times the rate of non-Hispanic Americans in the US. If taken as an economy separately, the total spend of Hispanic Americans, currently about $1.3 trillion, would be the 15th largest economy in the world. That's pretty significant. Secondarily, Hispanic Americans, as with most ethnic groups and other segmentations of the healthcare market, have certain healthcare conditions that they over-index towards, as well as under-index towards. So for example, certain populations of Hispanic Americans across the US have a higher rate of obesity, even higher than the general population. Certain populations of Hispanic Americans, particularly children, are more likely to die from asthma. The fact that anyone in the US any child is dying from asthma in the US, in my mind, is pretty amazing. And there's also variation as far as the country of origin is concerned. So for example, Puerto Ricans over-index more towards asthma. Mexicans tend to over-index more towards gastrointestinal disease, or GERD, or acid reflux. So even though the Hispanic American population can be viewed somewhat as a one market segmentation of 55 million Americans, as with any segmentation, there's always variation. And one of the key variations our research has shown is that country of origin will indicate what health conditions certain populations may over-index towards, or even under-index towards. The third driver that we think really makes healthcare for Hispanic Americans a great opportunity for healthcare organizations is the greater coverage that Hispanic Americans are starting to avail themselves of, whether it's through the Affordable Care Act, ACA, or Obamacare, and Hispanic Americans signing up through state-run exchanges, or gaining more commercial coverage through their employers as they become more and more participants in the workforce, or even starting their own businesses as sole contributors of their own insurance. More and more Hispanic Americans are getting health insurance coverage. About 80% of Hispanic Americans currently have health insurance coverage. So those are the three main drivers that we think really pose a wonderful opportunity for healthcare organizations to take advantage of. Going a little deeper on the affluence of Hispanic Americans, I think you can't pick up a newspaper these days without seeing how there's more and more economic activity and focus on trying to capture the Hispanic American market. The affluence of female Hispanic Americans is also gaining very rapidly, and that's important for healthcare since, as in many segmentations, the female of a family or extended family often makes the healthcare purchasing decisions or is in charge of healthcare as a whole. our research has shown that's even more so for Hispanic American households. The median age of Hispanic Americans is about 27 years old versus non-Hispanic Caucasians, it's 37 years old. Hispanic Americans, on average, have a larger lifetime expectancy. So what does this mean? It means that if you're able to capture the Hispanic American segmentation and deliver excellent service and build up brand loyalty with that population, over a lifetime of them being a healthcare consumer, you're actually going to make more money, to be blunt, than you would with other types of populations. So this should be something that is resonating in every healthcare organization's mind that is looking to see how they can grow their top line as well as their bottom line. I think the other interesting thing to point out here is that our research and other studies have shown that Hispanic Americans in general, as consumers, tend to be more loyal. You know, oftentimes I'll talk to healthcare executives and I'll give this similar presentation. It usually runs about an hour, so I apologize for it being truncated. And invariably, they'll say, George, we get it. We got to go after this market. It's a growing market, but I have 150 other things I need to do also. I need to figure out how I'm going to play in the accountable care organization market. I need to figure out whether I'm going to buy that hospital down the block or build a new hospital. Come talk to me next year about the Hispanic American market. And our response to that is understanding the Hispanic American market, giving all its growth attributes and its increasing significance in healthcare should inform all those strategic decisions. And if you're not taking into account that market when you're making these big strategic decisions, then you're missing the boat on the new emerging America. So thank you, and hope you enjoy the rest of the morning.
This year, you will have the opportunity to make your voice heard and contribute to the future of our city, our state, and our country. KHOU 11 and the Houston Hispanic Chamber of Commerce encourage you to make a difference and cast your ballot during the elections this November. The registration deadline is Tuesday, October 11th, and Election Day is Tuesday, November 8th. Go out and get registered to vote today and make your mark on the future by voting this November. Visit harrisvotes.org for more information. Before we get to the questions, why is the Chamber important to United Healthcare? And you could have served on any board, but when we asked you to serve on the Chamber board, you had to say yes.
Well, that probably a large part was because of you made me offers I couldn't refuse, I guess, right? Well, I think, you know, the relationship with the Chamber started long before I came to Houston. And I think really to the point that the gentleman spoke about earlier, the Chamber has helped United Healthcare here in Houston and in South Texas understand the Hispanic community, its needs. And I, you know, Laura, we talk about this a lot. I think it helps us hopefully access that same trusted source that the Chamber is in the community and give us access that we wouldn't otherwise have. So as much as you thank us, I thank you and the Chamber for allowing us to be part of it for such a long period of time, and certainly a relationship that we enjoy and hope to continue long into the future.
Folks like AARP, United Healthcare, UPS, Amegy, so many others understand that we also, as you saw on there, we're the youngest segment. We're earning more, we're getting more educated, we're going to live longer. So we hope that the physicians who are here joining us today, those executives, when you recruit, when you're looking for young leaders, that you contact our Chamber, because we have a database of young professionals and others who are bilingual, who understand this market and can help support it. And so we were really happy when we visited with AARP to find out about some of the extraordinary workshops, clinics, programs that they offer. And so what I'd like to do now is just ask our invited guest, Charlene, now tell us a little bit before we get into the Health Summit portion of it, more about AARP, its presence in Houston, and the fact that this is the only city that has an educational arm to AARP.
Thank you for having me here and having AARP at the table, because we really believe that it's only when we all come together and address the issues that affect, for the most part, everybody. You can't speak about just older persons without the inclusion of the family members.
Well, let's talk about public policy and Latino specifically. Is there anything that this audience should be aware of that's important that will impact them?
I think when we talk about health issues around access to healthcare, when we talk about Social Security and making sure that its viability is maintained so that future generations will have access to those funds that they've paid into. When we talk about Medicare fraud protection, again, educational, because we know that health is just not about medical care. It's about the whole gamut that impacts health.
So Dave, we all know healthcare is very complicated. Very, very complicated, and it's fluid. It's changing constantly. So regarding health insurance companies, how is United Healthcare helping its members manage these costs? Because every year when businesses get their information on health insurance, it seems the cost is going up, the services are going down. What is United Healthcare doing?
Well, our focus is really on helping individuals understand the value of high quality and the most cost-efficient healthcare. Not cheap, because I think sometimes in healthcare, when we talk about cost, especially when it's the insurance person talking about cost, it translates into cheap, and that's not what we're talking about. We're talking about, we want individuals to access the highest quality and most cost-efficient providers in Houston. And it's up to us, because we do have the data. We have access to the data, and we have to provide that data in a very relevant and quite frankly, the hardest part is timely manner to help people understand how to navigate to those high quality, high cost efficient physicians in Houston. I can't say thanks enough for the relationship that we've had with the Chamber, and we've learned so much over the last several years because of the relationship.
Well, thank you to Charlene and thanks to Dave Milich. Let's give them a round of applause. The Houston Hispanic Chamber of Commerce is the leading regional advocate for the economic and civic interests of the Hispanic business community. We seek to empower our members through a diverse range of programs and initiatives. The Chamber provides the business community with resources needed to build economic success. For more information, please visit our website at www.houstonhispanicchamber.com. We welcome you back to our program here. We are at our Health Summit sponsored by United Healthcare. With us today is Dave Milich, who serves on our board and is CEO of United Healthcare. Dave, welcome to the program.
Thanks, Laura. Great to be here.
Well, United Healthcare has been involved with us for some time now. Why is this so important to United Healthcare?
Well, I think, certainly healthcare is becoming a larger part of our economy and here in Houston, and we want to make sure that we're getting out the message that we want to deliver to the community around how United Healthcare is helping people live healthier lives, and there's no better way to do it than through our support of the Chamber.
And we know there are a lot of resources online, and you guys, especially in English and Spanish, have a lot of resources. Tell them more about those resources and how they can access it.
Sure. You can go to www.uhc.com and access all the information that we have available. You can also go to www.latino.com and get access to the Spanish information if that's what you want. And it'll give you information not only about healthy living, basic information about insurance, because what we find is that that's something that the community is really in need of. Consumers really don't understand this complex healthcare system that we have, and that's a great way to be able to learn about it.
Well, on behalf of the Hispanic Chamber of Commerce, we want to thank United Healthcare and all of our sponsors, exhibitors, and volunteers who are joining us today at our Health Summit. Dave, thanks again for being a sponsor and for your engagement in the Chamber on our board.
Thank you very much.
Welcome to our CBS program, Contacto. I've got some incredible, extraordinary entrepreneurs, corporate executives, and also physicians. Thank you for joining us, Doctor.
You're welcome.
Well, I know you're very involved in what we have here as one of our organizations that is doing some phenomenal work, but talk to us a little bit about why you're here today.
So, about half of people waiting for a life-saving organ transplant in our state are Hispanic. And there are issues which are unique not only in access to care, but also in delivery of care in a way that it's not just language, but also culturally appropriate. And we were inspired by a group in Chicago who is really at the forefront of providing care in a very culturally specific way to Hispanics. And so we felt like we needed to bring that here to Houston and to Texas, because this is the place where we feel like we have the greatest need in this area. And so we wanted to open a conversation between folks in both the healthcare field, the business field, and in the community to try to come together to talk about these issues and about how we can better deliver transplant care to Hispanic patients in Texas with end-stage organ disease.
And the truth is that we really lack those donations and people understanding the importance of being informed. It's a taboo issue in many parts of our society, especially among Hispanics.
Yeah, you see, and transplantation is the only field in medicine which requires two people, right? And whether that first person is either a living donor or a deceased donor, we can't do transplants and help people with end-stage organ disease unless there's that second person involved. And I think that educating people and trying to debunk some of the myths about donation, both on the living donation side and the deceased donation side, is one goal of our organization to try to help increase organ availability for people who really need it. So.
Well, Doctor, thank you for being here, and there's more information that you can see where you can go, call, get information, and let's make sure that we're donating and that we're informed. Doctor, thanks for being with us.
Thank you so much.
Thank you.
Thanks.
The Houston Hispanic Chamber of Commerce is the leading regional advocate for the economic and civic interests of the Hispanic business community. We seek to empower our members through a diverse range of programs and initiatives. The Chamber provides the business community with resources needed to build economic success. For more information, please visit our website at www.houstonhispanicchamber.com. Hello, welcome to Contacto on CBS. I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. We're happy to have you joining us today, and we're going to talk to you a little bit about a conference that's coming to Houston, new to Houston this year, and it's Prospanica. Prospanica President and CEO is joining us. Hello, Tomas. Thanks for joining us.
Thanks for having me.
Well, we appreciate it, and most of all, we're looking forward to having your conference here in Houston. But for people who aren't familiar with Prospanica, why don't you tell us a little bit about it?
Yeah, our mission is to empower Hispanics in the social, economic, and educational realm. In that, we've traditionally been a group that served MBAs. We were formerly known as the National Society of Hispanic MBAs, and we changed our name this year to match our current mission.
And so how many people do you expect at this conference?
About 4,000 to 5,000.
And it's not only MBAs, but from my understanding is that you have a lot of corporations who attend, who are recruiting. You have young professionals who've just graduated, and then other people who are looking for opportunities that perhaps are executives or have been in the work arena for some years now, right?
Right, so in our new mission, we're adding more groups to it. So certainly we'll have well over 100 organizations looking to either get students or to hire, things of that sort.
And a great place to network, bottom line.
It is a great place to network, and it's an important place to network, not just in the formal sessions, but as you know, in the hallway,
yes,
at the lunch meals.
Sure. Tell me a little bit about the formal session. So if you attend, and let's say you're someone who just graduated from college, what might that person be able to experience?
Well, I'd give them the whole thing, right? Because I actually usually say the second you walk out the door,
yes,
you're interviewing. Okay. But you have the opportunity first to do the expo floor where you can go to a booth and look for an interview and talk to the companies.
Yes.
But I think as important, frankly, not that we've measured it, is we have professional development sessions. And usually there's a company that has sponsored it there. Okay. So you can meet the speaker, you can meet the companies.
And take some good content away.
Absolutely. We have our meal events where you could strategically sit with a university or company again, and over lunch casually meet somebody.
So lots of networking, so bring your resume, bring business cards, and be ready to get out there and sell yourself, correct?
Absolutely.
And so in Houston, we know oil and gas, there have been a lot of layoffs, a lot of people with great experience who would love to stay in Houston, but some are realistic and understand they may need to leave Houston. What might you say to those individuals who are looking for opportunities, that are seasoned employees of oil and gas or other sectors?
Well, from what we hear from the other sectors, the number one request we get is we need more and more Hispanics in our companies.
And bilingual Hispanics especially.
Especially, that's a big advantage.
Yes.
For sure. So the opportunities really abound. And I mean, every week I'm fielding questions about how can I match our Hispanic membership to the corporations and universities and other organizations for that.
And the idea really is that we need more Hispanics, more women, more diversity in corporations. At the end of the day, we still need to do a better job.
Yeah, so our people need that,
yes,
and our country needs that, right? Our country needs it for global competition.
Yes.
We need the diversity of thought.
Yes.
And you know, our group is a little unlike some other groups. We're not monolithic. Our group brings diversity, and we are extremely diverse unto ourselves, which can be a challenge. but is also the beauty, I think, of the Hispanic community.
And you're expecting people from all over the country to gather here and congregate for this convention?
Yeah, we have over 40 chapters all
Okay.
over the country.
I see.
So they'll be coming in from all over the country.
And a very large, strong chapter here in Houston, too.
Yeah, we have about 1,500 members here.
Okay.
Houston's an original chapter of ours when we first started our chapters
Yes.
in 1991.
Uh-huh.
So it's a key chapter for us, always has been.
For more information, where should they call?
They should,
Contact.
yeah, they should go to prospanica.org. It's prospanica.org.
So the conference again, what are those dates?
September 28th to October 1st.
September 28th through October 1st. We hope that you'll join the Houston Hispanic Chamber of Commerce as we partner with Prospanica for their conference that will be here in Houston, Texas. I want to thank you, Tomas, for your leadership as CEO and to your entire organization for the work that you're doing. Very important that we continue to move Hispanics forward. And also congratulations on your new name, Prospanica, which is originated here by one of your members in Houston.
That's right.
And we're very proud of Prospanica and the important work that they're doing. And under Tomas's leadership, we thank you and your board for bringing this conference here to Houston.
Thanks for partnering with us.
Absolutely. We'll be right back. Thank you. This year, you will have the opportunity to make your voice heard and contribute to the future of our city, our state, and our country. KHOU 11 and the Houston Hispanic Chamber of Commerce encourage you to make a difference and cast your ballot during the elections this November. The registration deadline is Tuesday, October 11th, and Election Day is Tuesday, November 8th. Go out and get registered to vote today and make your mark on the future by voting this November. Visit harrisvotes.org for more information. Hello, welcome to Contacto, brought to you by the Houston Hispanic Chamber of Commerce. Dr. Laura Murillo, President and CEO, joining us today. I think is probably your first interview, if not among the first here in Houston. Joining us today is the new superintendent of the Houston Independent School District, Dr. Richard Carranza. Welcome to the Houston Hispanic Chamber of Commerce and to Houston.
Thank you so much. It's a pleasure to be here.
Well, we're very excited about the opportunities that this presents for our students for this huge school district. I know you've just arrived, but what are some of your first initial impressions of Houston?
Houston is a can-do city. It's a diverse city. Every corner that I've visited so far, every place I've gone, from schools to restaurants to you name it, people just have this enthusiasm about the city and, quite frankly, an enthusiasm about the school district. So what I've really been struck by is this can-do attitude and this real sense of optimism.
Yes. And I know for a lot of people who might be watching may not be familiar with your background. Give us a brief summary of who you are and why you decided to come to Houston.
Sure. So I was born in Tucson, Arizona. That's where I was born and raised. I was a son of two blue-collar workers, a sheet metal worker and a hairdresser. And my brother and I went to the university there. I was a high school teacher for almost a decade there, and then an administrator, high school principal. Went to Las Vegas, where I was a high school principal, then a region superintendent. Then went over to San Francisco as a deputy superintendent, then superintendent, where I spent the last 4 years as superintendent. Houston drew my attention because of everything that I have found since I hit the road here, or hit the ground here. It's innovation, it's diversity, it's can-do spirit. And the Houston Independent School District has been on my radar for many years because of people that I've known that have been part of the system. And I've always been struck by how forward-thinking they were and just how passionate they were about doing right by kids.
Well, we're happy to have you here. And so something that might be on your platform for the next 6 months, what are some of your top priorities?
Well, one of the first things is really taking the time to get out into the community, to talk to lots of people, visit schools, visit different organizations like the Latino Chamber. But what I really want to get is a pulse. Where have we been? And where is the community sensing that we need to go? Obviously working very closely with the trustees as well. And within the next 6 months, really starting to engage the community around a long-term vision. I think we often get lost in strategic plans that are very specific towards a goal, but if the goal doesn't align to a broader community vision that everybody has had a voice in, then the plan just becomes a plan, and there'll be another plan. And I think what I'm really hoping to do, along with the trustees, is to really engage people in thinking, what is the vision for us educationally in Houston, and how do we all play a part?
Great. Well, on behalf of the Houston Hispanic Chamber of Commerce, we thank you for joining us. Please know we're here as a resource for you, and we thank you and the trustees for making such a great decision, bringing you to Houston in the best efforts for our children. Thank you again, Dr.
Gracias.
Carranza.
Thank you.
On behalf of the board and staff of the Houston Hispanic Chamber of Commerce, we thank you for joining us at our Health Summit brought to you by United Healthcare. Have a great day.